Why do you need to stay off your fat for 6 weeks after surgery? That's a common thing that we tell patients, and a lot of docs will tell them. And I get that it's sort of that question like, well, why is that? Well, I hope to answer this for you here on this whiteboard. So what we're going to talk about is what makes the fat live. And if you ever thought about that, I can take fat from a different part of your body and start to inject it in a new part. Now, again, my trusty little diagram, skin, muscle, fat, which is for how most of us are made up. We can actually add a lot of fat above the muscle. Now, I want to give you a little bit of history here, because in the old days, we used to actually inject fat into the muscle itself. We don't do that anymore because that has a high risk of fat embolisms or fat clots going to the heart or lungs, and those can be deadly. The reason, though, we started by injecting fat into the muscle was because the muscle has a ton of blood supply. That's why it looks red and pink. And so that blood supply nicely creates new blood flow to the fat cells, and it allows them to live. You get a good survivability rate. When we put fat above your muscle, it will still survive, but it's now reliant on developing a blood supply. And so that's actually called angiogenesis, where actually blood vessels will come, an artery and a vein, to those fat cells and actually deliver and remove nutrients so the fat itself lives. That's called angiogenesis. And you say, well, how long does that take? Well, it takes about 4 to 6 weeks for that to get established. So that's why we tell people stay off your butt for 6 weeks, because that's about how long this process can take to really become nice and mature. The other thing I want you to think about is fat cells themselves are extremely fragile. And that's actually one of the reasons why in the beginning, people thought that transferring fat wouldn't work, because the fat cells were so fragile. You can think of them as almost like a really, really filled in water balloon. They've got a really, really thin sort of outer sort of cell layer filled with a lot of fat inside of it. Cholesterols and sort of triglycerides and all these things are in those adipocytes, those fat cells. So the slightest little injury can actually break that wall and everything sort of flies out, and that adipocyte or fat cell dies. So we've got to give enough time for the blood flow to come in to get the fat cell established. And we also want to minimize pressure put on these fat cells so that we're not going to actually break these very fragile cells and have them fall away. So how much of the fat actually survives? And it's really a number that you're going to see a lot quoted, which is going to be about 50 to 80%. And what we've found is that if we stay off that fat for at least 6 weeks after that surgery, we get numbers closer to 80%. If we stay on the fat and we're sitting a lot, we see numbers closer to 50%. Because again, we're just losing more of them because we're not treating these cells in the delicate way that they need to be treated prior to the blood flows being established. So that's fat survivability, and that's why you're told to stay off your butt for at least 6 weeks.